she's coming to you for symptoms, and you can correct them easily with medication. But at the same time, there have been young girls who have got a lot of facial hair, a lot of pigmentation. When she's insulin resistant, when you see a lot of pigmentation around her neck, she may have pigmentation around her mouth. She may have pigmentation on the nape of her neck. And if you see that typical pigmentation, or what we call acanthosis, where the skin gets little thin, then those are typical signs of insulin resistance. Or you may get black moles all over your body. So those are typical. You look at it and you know that this patient is insulin resistant. Waistline being more than 80 centimeters is insulin resistant. So when girls have a lot of facial hair, when they're losing hair from the scalp, young girls who want to look beautiful, want to have boyfriends, and they want someone to woo them, and nobody's looking at them because of the problems they have, they do get through a lot of mental anxiety, a lot of depression. They do tend to suffer a lot, both physically and mentally. So I think that's an associated thing which is very, very commonly seen. And these young girls need a lot of empathy and a lot of management, maybe sometimes just through counselors, and some of them also by the psychiatrist. So that's one long-term health issue I see in young girls. The second thing is, of course, once they're on treatment, they settle down. The second thing is, of course, for infertility issues. When infertility issues, when women don't get pregnant because of their irregular periods. You know how fertility is counted in our country. It's such a cultural thing that every woman should get pregnant. Unfortunately, that affects women, and it causes a lot of social problems at home, cultural issues, and of course a mental anxiety. So mental anxiety comes in all the four decades of life when a woman seems to be having PCOS. Then comes the pregnancy, then the obesity. The obesity affects the girl when she's young, affects the woman when she's getting married, affects the woman when she gets pregnant. It affects her all her life. So that obesity comes in the way. Then you have the pregnant woman, sometimes she loses the pregnancies. She gets pregnant but she has a miscarriage. That is again because of the hormonal problems. If her sugars are high and if insulin is high, she's not been tested, or her thyroid is affected, which commonly happens in PCOS patients, she may never have been tested. She goes ahead, gets pregnant without testing. Now that is something I've always said. Before getting pregnant, 3 months before, at least see your doctor. Start off on your folic acid. Make sure your reports are out there, and only then plan a pregnancy. You go on a holiday, don't you make your plans earlier? Don't you book your flights? Don't you book your hotels? Don't you book your tours? You do book everything. But when you're getting pregnant and you're going on a 9-month journey with that baby, why aren't you planning your pregnancy? The commonest abnormalities we find in babies are the ones where the women's sugars have been high. And those give rise to congenital malformations in the baby, which is 8 times higher than normal, when with a normal sugar. So these are things which affect women. When they recurrent, continuously 2-3 miscarriages or having children with abnormalities, it creates a toll, mental health, mental problems, etc. Emotional issues, anxiety, depression. Then comes a 40 plus woman. By then she's developed hypertension, she's developed diabetes, she's developed severe obesity, she's got problems with her knees, problems with her hips because of the obesity. She's going through all kinds of unfortunate incidents in her life, disorders. She gets high lipids, and then sometimes a heart attack at a premature age, or disability. Then of course, as she becomes 50 plus and she develops postmenopausal bleeding, that extra estrogen in her body, which is coming from the fat collected in her body, is causing the lining of the uterus to get thicker and thicker, which she doesn't realize. And one day suddenly, after 5 years of no period, she starts bleeding. That's when she goes to the doctor, and then she finds she's got uterine cancer. So in short, what we say is that every woman normally needs a checkup once a year. But in our country, where diabetes is so common, where in our country where certain conditions are more common, even in the rural areas we see this happening. We just completed a study where we found so many problems even in the rural area. So in short, we have to make sure that every woman, especially a PCOS woman, who's more at risk of having these problems, should see her doctor once a year for an annual checkup. She should go before a pregnancy. If she's having a fertility issue, she must take help If she's got depression, etc., take help from the mental health experts. There's nothing wrong. Just take help and get a regular checkup, and then there'll be no problems in your life. You will sail through life very easily with no issues at all. That's what I would say.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.